Everyone, welcome back to our YouTube channel Sowkya Med Vision. We are discussing about bones of upper limb. In the last class, we have told about clavicle and scapula, their attachments, their joints and their features and site determination. Today we are going to discuss about humerus, the ends and shaft, its attachments, joints by it and site determination. Here we go. The part of upper limb. This is the upper limb. The part of upper limb extending from shoulder to elbow is known as arm. So, the arm containing bone known as humerus. Humerus is the bone of arm. It is the largest, longest and strongest bone in the upper limb. It is the one of the longest bone. As it is the longest bone, it should contain three parts, right? The upper end, longest shaft and the lower end. Yes, as we know, the longest bone containing three parts, upper end, shaft and lower end. So, the upper end of the humerus is articulated with the glenoid cavity. This is the glenoid cavity of scapula. This triangular bone is known as scapula. So, the upper end of the humerus containing head. So, head of humerus is articulated with the glenoid cavity of the scapula, forming shoulder joint. The lower end of the humerus is slightly triangular in ending. It is forming elbow joint. It is forming elbow joint with the bones of forearm. What are the bones of forearm? Laterally radius and medially ulna. So the upper end is going to form shoulder joint. Lower end is going to form elbow joint. Yes, let's see the description of humerus. And now the humerus, it is a bone of arm. As we said, arm containing bone, the bone of arm. Now it is the strongest and the longest bone of the upper limb. Humerus is the strongest and the longest bone of the upper limb. As we know, the longest bone containing three parts, upper end, lower end and the shaft. Now let's see the upper end. The upper end of the humerus containing five major features. The head, this part of the humerus upper end is known as head. Yes, and the neck. The humerus containing three necks. Anatomical neck, surgical neck and the morphological neck. Containing three necks and one head. This is the greater tubercle. Along laterally, towards laterally, there is a tubercle called greater tubercle. If it is a greater tubercle, there is one more tubercle which is lesser. It is presented medially. Yes, and the space between this tubercle is known as what? Intertubercular sulcus. So this gap, the space between these two tubercles is known as intertubercular sulcus. Yes. Now the head part of the upper end is smooth, is rounded. It forms 1/3 of the spear. It is round, which forms 1/3 of the spear, and it is covered by hyaline cartilage. Why? As we know, any joint articulation surfaces are covered by, lined by hyaline cartilage. So the head of humerus is involved in the formation of shoulder joint, right? Hence it is covered by hyaline cartilage. Now neck. As we said, there are three necks: morphological, surgical and anatomical neck. It is related to axillary nerve. Axillary nerve is one of the major nerve formed by brachial plexus and posterior and anterior circumflex humeral artery, which are the major arteries in the shoulder and the shoulder joint. Now, greater tubercle, as we said, it is presented laterally. Lesser tubercle presented medially. This is the greater tubercle presented laterally, and this is the lesser tubercle towards medially. The greater tubercle presents three facets. Facets for what? For the attachment or insertion or the articulation. Yes, here these three facets are for attachment of three muscles. They are supraspinatus, infraspinatus and teres minor. There are one more muscle, teres major, but here it gives attachment for teres minor. Let's see. This is the anterior view. This is the posterior view. This side it is the lateral. In the posterior, this side will becomes the lateral, right? So the three facets are these three. Impression for supraspinatus, for infraspinatus and teres minor. These three muscles get attached at the greater tubercle of upper end of the humerus. Yes. Now lesser end, lesser tubercle, which is presented medially. This is the lesser tubercle presented medially. Here subscapularis muscle gets attached. In the last class, in the scapula, we have said that the scapula containing two surfaces, anterior surface on the posterior surface, anterior also known as costal surface, posterior or the dorsal surface. So anterior costal surface gives origin for subscapularis muscle, which get attached at the lesser tubercle. The subscapularis get attached at the lesser tubercle. Yes. Now the intertubercular sulcus. The space present between these two tubercles is known as intertubercular sulcus, and it presents medial and lateral lip. Any space is having two side elevations, right? The lateral elevation is a lateral lip and the medial elevation is a medial lip. Yes. The intertubercular sulcus containing long head of biceps. Biceps. Bi means what? Two. Ceps means what? Heads. So the biceps muscle containing two heads. One is the short head, one is the long head. Here the intertubercular sulcus gives attachment of long head of the biceps. Yes. Now the lateral lip. The lateral lip is towards the lateral. The lateral lip gives attachment for pectoralis major, medial lip gives attachment for teres major, and floor of groove gives attachment for latissimus dorsi. Pectoralis major is a major muscle in the pectoral region, and teres major, as we said, there are two muscles, teres major and teres minor. Here the medial lip of intertubercular sulcus is giving attachment for teres major, and the floor of groove is giving attachment for latissimus dorsi. Latissimus dorsi is the major broad muscle in the back. Now shaft, the shaft of the long bone containing three borders and three surfaces. Yes, what are the borders? Anterior border, medial border and lateral border. Now see the anterior border. It is along lateral lip of the sulcus. See, this is a lateral lip, this is a lateral lip, and this is a medial lip. The anterior border is along the lateral lip of the sulcus. Yes, which contain deltoid tuberosity. This is the deltoid tuberosity. Yes. Now medial border, from medial lip of medial lip to medial epicondyle. This epicondyle is presented at the lower end of the humerus. Yes, the medial lip, this will be the medial lip. It gets along the medial epicondyle. This is a medial epicondyle. Yes, this region is a medial epicondyle. And now this medial epicondyle gives attachment for two muscles. Insertion of coracobrachialis muscle. This is the muscle of arm region. There are three muscles of arm region. One of that is coracobrachialis muscle, extending from coracoid process. Insertion at medial border of shaft of humerus. And another muscle is pronator teres, which is a major muscle in the superficial layer of forearm. Yes, it gives origin to humeral head of pronator teres. And next, third border is the lateral border, which is prominent lower part. Yes, this is the lateral border, which is very prominent in the lower part. See, forming what? In the lower part, it forming lateral supracondylar ridge. Yes, it is forming a ridge in the lower part known as lateral supracondylar ridge. So alternatively, there is a medial supracondylar ridge in the medial side. Yes. Now let's see the surfaces: anterolateral surface, anteromedial surface and posterior surface. Anterolateral surface containing deltoid tuberosity. See, this is a deltoid tuberosity. Here is a deltoid tuberosity extended posteriorly to. And anteromedial surface. In the upper part, in the floor of intertubercular sulcus, it is prominently seen in the upper part, in the sulcus, in the floor of the sulcus. Yes. Now, the posterior surface, this is a posterior view. The posterior surface containing a spiral groove or a radial groove containing two components, radial nerve and profunda brachii vessels. This profunda brachii artery is the branch of major artery of arm known as brachial artery. Yes. And now, lower end. Coming to lower end. The parts of lower end. First of all, you remember these parts. Then remember articulation. What are the process that are articulating with the lower end? Now, capitulum, trochlea, medial epicondyle, lateral epicondyle, coronoid fossa, olecranon fossa. First remember these parts. Then see what are the articulating parts. Now, capitulum. This part of lower end of humerus is known as capitulum, presenting laterally. So what is the lateral bone present in the forearm? Radius. So this capitulum is articulated with the disc shaped head of radius. Yes, this is a trochlea presenting medially. So what is the medial bone in the forearm? Ulna. So obviously it gets articulated with the ulna. And medial epicondyle and lateral epicondyle. This is a medial side and this is a lateral side. So the medial epicondyle and this is a lateral epicondyle. Medial epicondyle gives origin for common flexor origin. Okay, it gives origin for superficial layers of flexor muscles in the forearm. So there are two layers in the forearm, superficial and deep. So the medial epicondyle gives origin for superficial layer of flexors of forearm, whereas the lateral epicondyle gives origin for extensor muscles. So it is known as common extensor origin. Yes. Now, the coronoid fossa. See, this is coronoid fossa. Presented anteriorly for what? To articulate. Obviously this is medial side presented. So articulated with the coronoid process. This is a fossa, so something should get fitted into it. So this fossa is for coronoid process of ulna. Yes. And next, olecranon fossa. This is the olecranon fossa presented posteriorly. This is the posterior view presenting olecranon fossa. Fitting for what? Olecranon process of the ulna. Olecranon process of the ulna is fitted into olecranon fossa of the lower end of the humerus. Yes, these are the parts of lower end: capitulum, trochlea, medial epicondyle, lateral epicondyle, coronoid fossa and olecranon fossa. Let's see the ossification. There are 8 centers of ossification of humerus. One is the primary center, obviously for the shaft, and 3 secondary centers for upper end and 4 secondary centers for lower end. And this is a complete brief discussion about the humerus. If you have any doubts, feel free to comment in the comment box and like the video. Thank you.